Flying out of the car. We do see people that get ejected from the vehicle, and when EMS actually comes in, they'll tell us how far somebody was actually ejected out of the vehicle, and helps us to know basically how much force was going on in the accident. Busting through the windshield, we always ask, is there spidering of the windshield? Spidering of the windshield typically occurs from a head injury. The windshield itself shouldn't just shatter away. It kind of stays all together. It's actually made that way to protect everybody from shattering glass. Oh no, oh no, I didn't even know it's part of the game. Oh! You're dead. A fall greater than 3 times your height is a major trauma. The fact that this is a ton of stories, unfortunately, that person's not gonna make it. Oh! Oh my gosh. Landing on another human being, that other individual is probably dead pretty much right away. It just depends on where the individual is actually being hit and injured. Wow, head-on collision going, 50, 60, 70, 80 miles an hour is a recipe for a disaster, especially if you're potentially not seatbelted. Typically, if somebody's flailing out, they're kind of moving everywhere, except if you're unconscious, you're kind of just rotating through the air. Oh! Landing right on your tailbone, the coccyx bone, which is the end of your vertebrae, and then your sacrum down there, and then also your lumbar spine. So all that can be snapped, your pelvis can shatter open. Yeah, getting destroyed. There's so many times where pedestrians are hit by a vehicle. Most of the injury is actually on the fall. You're having a whiplash injury, and then you're having a head injury hitting the concrete. You smack your head on the back, then your brain goes flying forward and smashes inside your skull back and forth.
Hey man, I ain't too sure about
Don't
this.
do it. What? Is it jumping in the water? Jumping from that great of a height, hitting water is probably equivalent to solid ground. You're gonna have a significant amount of blunt trauma to your brain, to your chest, to your heart, not survivable.
What's that on the floor? I thought those...
What? When you get out of the car, you gotta be super careful, make sure everything around you is safe. Depends where the car hits you. A lot of times we've seen people who lose their lower extremities and their legs. You're also worried about all the vasculature that is supplying all the oxygen to the tissue below that point. If it's totally destroyed, the tissue becomes ischemic, dies, and it needs to be cut off. Oh, he's being dragged. You're just getting everything abraded off. When that occurs, you actually need a skin graft if it's that bad. Oh! Add insult to injury, you got falling objects. You can cause traumatic injury to your head. You can cause fractures of bone. You can cause people to get trapped underneath those things. So those are the other injuries that could occur. I don't know why this guy has a bazooka. Oh my gosh. I mean, explosion right in front of you. I don't think there's much surviving. You're probably going to be in more pieces than what that depicts. Oh, man. Oh, he's getting up from that. He flew into somebody else, which actually saved his life, but killed the other individual from the compressive force. Possible whiplash, which then caused decapitation, basically, versus any blunt trauma injury, which would cause the heart or intracranial bleeding. Oh! It looks like he just landed right on the groin. I don't know if that would kill you, but it would kill your future children. There are definitely traumatic injuries that occur to the scrotum. Sometimes they just need to heal on their own. Sometimes you need a plastic surgeon or a urologist to sew it back up. Oh, man! Biggest thing about burn injuries is making sure that you get the fire out and then get to a facility that can help you. You want to get off the charred clothing. Anything that continues to burn, you need to get off. Even the hot liquid that's there, make sure it's off. Oh my gosh! When you have that much fire, you can ingest or breathe in those flames, which then will cause swelling of those mucosal layers, which then increases the risk that you're going to have an airway compromise. Oh man, oh! That speed with that blade probably caused some objects to fly off and go in different directions.
Oh, stop! Look out!
Airplanes, not a good idea. Oh! Oh man, that was sick in multiple different ways. Obviously, there's precautions. Stay away from propellers, stay away from jet engines because the potentially of getting sucked in. And then wait, why are you running in the remains? I don't understand. The amount of blood, you know, it could be. We have anywhere between 10 to 12 pints of blood, basically like 5 to 6 liters. It just all depends on the size of the individual. Get away from the gas or whatever that is. Correct me if I'm wrong out there, but I don't think a bullet could start a fire. You need a spark or something to ignite it. Wow. The flames are basically using the oxygen around him and taking it away from him, so he won't be able to breathe. Most likely he's going to die of asphyxiation first over injuries relating to the burns on the outside of the body.
Put your gun down.
Not a good situation.
Same goddamn leg.
Shot right in the left leg, kneecap versus like femur. So it all depends if it goes straight through. Does it break through the bone and does it shatter the bone? Does it miss the bone and just go through the soft tissue and goes through and through pretty easily? A broken femur is probably one of the worst bones to break due to pain. It's got a lot of nerves around the areas, but also because the bones are typically overlaying, and that causes a significant amount of pain. Oh man, they do a good depiction of what the brain matter would potentially look like. So it does kind of look like a grayish white. It's soft, and then bone fragments can be kind of left out. The exit wound has a lot more projectile coming out versus the small hole that is the entrance wound, which is quite common.
These guys kill each other.
Oh my gosh. Sometimes if you're a healthy individual, then there's a potential that you could still be alive. If there's no signs of life, but the body's still alive, it gives the opportunity for organ donation if that's what the patient wanted or what the family wants. Okay, wait a minute. Before we even start, he's riding a motorcycle. This game would be so cool if he actually put on a helmet. Because obviously you need to have a helmet in case you fall. Of the people that I see get into accidents and have bad things happen, it's because they're not wearing a helmet. You can get really bad road rash, snap a bone. I've even seen people come in with their limbs missing. Please wear a helmet if you're actually riding a motorcycle. And trying to do weird tricks with kicking it. Oh man, duh. Literally that type of injury is going to take off your head. If you do survive, EMS will get there. They'll put you in a seat collar. If your helmet's there, they'll actually still keep the helmet on and stabilize your neck with tape and maybe some pillows to try to pull off the face shield as well as the helmet all at once. Oh geez, 2 people, wheelie. Oh, get off the train! Oh, wow. The guy gets run over by a train. He literally gets cut in half. Is that survivable? Yes, you've heard of weird stories where somebody survives, but very much unlikely. If it's your abdomen, you're cut right through the abdominal aorta. Your blood's just gonna pool right out of your body super fast, and you're gonna die pretty quickly. We're yachting, and we're trying to land on the yacht. Oh, the blood that's smearing on the nice white yacht. You're having multiple abrasions and you're getting your skin just kind of ripped off because the yacht has the coatings. When you fall on a gymnasium floor and it's got that coat of like lacquer on it, same idea where you like skin it off. You get some sort of head injury that can cause you to pass out. You smash your head, your brain goes forward and backwards. So you can have a coup, counter coup injuries, and you can bruise both ends. You can rip the bridging veins of the brain itself, which then can lead to a subdural hematoma. You can also get a subarachnoid bleed, and you can get skull fractures. So these are the things you worry about when somebody hits their head. Nice.
Here for the magic touch.
Whoa. The amount of people that I've seen that have been hit by cars, man, people get destroyed. Sometimes we even see people who come in who are still alive, but their skull is busted open and you actually see brain matter, and some of the brain matter is actually coming off. Ride the bike. Oh! You would not be alive if a car comes smashing down on your unprotected head. super close range like that, blood splattering everywhere, and I'm assuming that a lot of the tissue would be gone from such a close range.
There won't be a trial unless you're...
Oh! Immediate stop, head injury. The big thing you worry about is drowning in this instance because now you're unconscious, you don't have a life preserver or life vest on. And if you're in a dead man's float position, your head's in the water, you won't be able to breathe. So hopefully somebody there to get you out ASAP. And then you also worry about cervical spine injuries, but you do your best to save their life and protect their neck, but you're also trying to keep them from drowning. Ouch. You fall off that ledge, hit the rail, you can actually fracture a bone pretty easily. You get concerned that you're going to break a rib, and if you break a rib, then you're concerned that you might puncture a lung. But then, how the heck do you avoid a falling helicopter where the blades are now just cutting you in half? That's like the worst outcome.
This is the one thing we didn't want to happen.
I gotta call my dad. Poor man.
Oh my gosh! Texas Chainsaw Massacre is the first thing I'm thinking of. It's ripping through the left side. The left side has your spleen, your kidney on the back. You can actually live without your spleen, but if your spleen gets injured, a lot of bleeding. You can live without one kidney. Very interesting what we have one of and what we have two of. What is this thing? It almost looks like one of those wind turbines that we see that are supposed to generate energy. I've seen people in smaller versions of like a meat grinder where they've gotten their hands stuck and they've come in degloved. Or the hand totally removed. If you don't have the hand to replace it, it's just an amputation at that point and close up the end of the wound. You just slid your face against the wooden ground that probably just caused a lot of splinters to go in your face. If you ever get any splinters, you can try to take them out with a tweezer. Some other easy, fun home remedies would be like using duct tape, trying to get it stuck to the duct tape and pulling it out. Elmer's glue, put it on there and then just peel it off. What? Took a shot right to the right flank, through the spleen maybe, or just above it, and could have went directly into the heart. Sometimes we see where one shot actually kills an individual or causes a significant amount of damage versus other times if you have lots of wounds and lots of through and through injuries, sometimes they actually miss everything and you're okay.
No why? Now give me that.
Oh,
What's up, home? I tell the best stories ever.
Oh my gosh, what? Man, that is scary. The guy's got a machete on them.
Machete.
It just took massive slices. We see a lot of people get slice like that on the back. Luckily the ribs are protecting, so it goes through all the muscle and the skin, all the subcutaneous fat there, which we can sew up. If you start getting deeper into the abdomen, if it goes through, a lot of times you'll actually have to have exploratory laparotomies where they actually go in and explore and see if anything has been cut open. Oh, what is this? Taser? Oh, he's got a taser.
My God!
Oh! We see a lot of people come to the emergency department with taser injuries.
Don't tase me, bro!
Or just to have the taser barbs removed. Typically when it ends up happening, a police officer would use the taser and they cut the wires off, but they're just these probes just sticking there in the skin and they have a barb on them. So if you try to pull it out, it obviously gets stuck in the skin. So we'll use an 11 blade to try to cut the skin off of where the barb is catching. Oh! Wow. Somebody getting hit, lower back.
My back!
You definitely worry about fracture. Down in the lower spine area, you worry about whiplash, you worry about cervical fractures, and then the trauma to the face. Typically, if somebody came into the emergency department with that injury, you get a head-to-toe CT scan and a full evaluation. A lot of times, people actually will come to the emergency department with these type of injuries and actually refuse all care and they'll just leave. Come on!
Come on!
Definitely happens. We see people who get hit by hammers all the time, either by accident when they're actually on the job site or on purpose. The people are using hammers as a weapon to hurt other individuals. Getting hit with a blunt object, you're not getting hit with the backside of it, which actually has the prongs. That's typical hammer. Oh.
Jesus!
chainsaw injuries. Literally, I've seen people take a chainsaw and pull it up to cut, and they've cut their own head. I've seen it bounce and hit people in the thighs or their leg, even onto their back, even hitting somebody else by accident, all on the job site. So you got to be really, really careful when it comes to using a chainsaw. Oh man, motorcycle accidents, a very common reason why somebody comes to the emergency department. We see everything from scrapes, bruises to, death, and then basically losing limbs. Sometimes it's related to speed, obviously, but then your protective gear. I always tell people, I'm like, literally wear full gear, leathers or Kevlar, helmet, gloves, boots. People laugh at me, but nobody wants a skin graft, and that stuff keeps you intact.
You's a stupid.
Don't fight in front of the police. Oh my gosh. If somebody gets hit in the jaw, you increase the risk of having a fracture to the jaw, losing a tooth, even just cutting the inside of your mouth. You can fracture your hand with something called the boxer's fracture, where you fracture the metacarpal relating to the fifth or the fourth, and basically they snap and they pop up. Holy cow. Multiple gunshot wounds to the chest and abdomen. I've seen people who have gotten shot multiple times and survive, and I've seen individuals that have gotten shot once and they pass away. It just depends on what's actually hit underneath, what vital organs versus how much bleeding. In this case, sometimes people do come into the emergency department still alive. You're worried about impending doom of losing airway, losing blood, and having the heart stop. Oh my gosh. This is...
What is happening?
It's a blunt trauma. It hits you shoulder, neck, maybe face. I would be worried about cervical fractures, large hematomas to the neck, worried about the underlying structures of the major blood vessels in the neck, and obviously fractures of the clavicle, the ribs, and the proximal humerus, aka the shoulder. Individuals who fall off of a motorcycle, a lot of times you want to get rid of the bike, get away from it, let it slide. As you slide, then a motorcycle hitting somebody going 30 miles an hour is probably going to be quite detrimental. Blunt trauma force, just depends on where the injuries are to see what ends up happening. Oh, wow. Biggest concerns are fractures in the neck. There's multiple different types of fractures that could occur in the neck, and they have all different crazy names. Jefferson fractures, there's hangman fractures, there's compression fractures, blowout fractures, there's all these funky names.
Woo! Funky.
There's compressive forces and hyperextension or hyperflexion that can occur, and then the effects on the spinal cord in that area. Oh my gosh, that's not funny.
That's not funny.
It actually happens in real life. People flip vehicles, they fly out of vehicles, people get run over. Getting stuck in the wheel, that is awful. We see people that get their legs run over, their foot run over, get fractures or dislocations. Sometimes are totally fine, it just depends. I'll see car accidents where people get thrown from the vehicle because they're not wearing their seatbelt. Paramedics will come in and say, hey, we found the individual like 60 feet away from the vehicle. That's probably not a good idea. Oh, wow. You're getting hit from behind, a whiplash type injury where the body kind of extends backwards, then compressed down, and even more hyperextension of the neck, which can cause significant amount of fractures to the neck, snapping off spinous processes.
What's up? Man, you suck. You a bust. Man.
Oh! Knife wound to the left lower quadrant of the abdomen. Basically, you're looking at your colon, some small intestines. Posteriorly, you have your ureter there, which is basically connects your kidney to your bladder where the pee goes down. And then if you go a little bit higher up, you have your spleen that's protected underneath the ribs on the left. But if the knife penetrates, it goes up, you can actually lacerate that. So a shot to the right side of the spine in the back, straight through, could hit the right side of the heart because it's midline, but to the right, also hitting right into the lung. As the energy goes into the body, it actually expands right, so it can cause more trauma. And it looks like it goes all the way through to the other individual, which is more on the left side, which can wreak havoc on the body, obviously, as well. Oh, geez. Whipping out a hammer.
Pick up the hammer.
right to the head. It does happen. People use any objects possible to injure each other, and a hammer is a quite common tool. Typically, they're causing more blood trauma, lacerations, avulsions of tissue, and could cause some fractures, especially hitting the skull. Oh, man. This is exactly what I'm saying about wearing a seatbelt.
That's what I'm talking about.
Multiple horrible things happening all at once. When people come to the emergency department after being thrown from a vehicle, there's so many injuries that we worry about. And we literally do a head-to-toe survey to check to make sure that we're not missing something. And most of the time, almost like a non-thinking, order everything.
We'll take the lot.
Head-to-toe CT scan because you don't want to miss something. Whoa. Oh, geez. I knew that was gonna happen. Crush injury. You're gonna potentially have some burns, and then any blunt trauma or direct lacerations or amputations because the weight of a helicopter. Hopefully all the weight didn't land on that individual. If it did, probably not survivable. Oh, who's got machetes these days? What the heck? At a tennis court, I've seen plenty of machete injuries.
Machete.
If you're awake and alert, compress the area. If you don't have anything to compress the area, you can try to compress with your own hand, and then obviously a tourniquet if needed. There's a lot of different things you can actually do or somebody around can do. Oh! What? Holy cow! Head injury, the big laceration, we would probably repair that with staples if it doesn't go all the way through. If it goes all the way through the brain and lacerates the brain and cuts it into pieces,
Oh no, my brains.
the potential of surviving is probably low. Just depends on what part of the brain, the function of the brain in that area that is injured. Some of them are survivable, but it needs to get through the skull. As I've said previously on many videos, really hard to get a blade into the skull. Whoa. It's like some Mission Impossible stuff going on. It looks like the legs are wedged between the wings, and if there's a lot of force going on behind the knee, you have your major blood vessels that are running there, so you can press those too much. You know, you can decrease some blood flow to the lower extremities, and obviously the blood is pooling down the other direction. You're flying fast, the difficulty probably getting air in and breathing. Then you're going to start having temperature changes as you get further up.
How about this?
Oh. Oh man, it just fell. Wait a minute. Okay, if somebody falls on their feet, you always worry about calcaneal fractures. The talus, which sits just above the calcaneus, and then you have your tibia right there, which sits on top. Because of the force, you always worry if somebody has back pain with these. Oof. If anybody's fallen on their coccyx now, that's the tailbone. Oof. And then you can cause laceration, fractures. The higher you fall from, especially greater than 3 times your own height, is a major trauma. Falling from that high, there's always a chance of death. Oh. Oh! Falling off of a horse, you're high up, you really have to worry about actually the horse falling on you. The horse weighs so much that it can cause crush injuries to yourself. Feel bad for the horse is probably injured as well. Oh. Oh. If you punch somebody in the mouth, you increase the risk of getting open fractures and open wounds. Bacteria from our mouths can get into the cuts. This is an older time period. Antibiotic use, not until later.
You know, life's a strange thing, but all in all, okay.
Oh. Whoa! Through the neck, your major blood vessels run either side. So you have your carotid arteries and your jugular veins. You have your trachea, you have your esophagus, and then on the other side, you have your spinal cord going. Wouldn't actually squirt that much per se. Oh! Oh! He's still rowing. Holy cow. When somebody actually gets lit on fire like that, it's taking away your oxygen. You're inhaling some of the flames. It actually causes inflammation, which then causes swelling, which then closes off your airway over time. This could happen minutes, not specifically seconds, but you can burn down into your airway. How is that even possible? Typically, people who come to the emergency department are already put out. You always worry about airway compromise. You're looking for soot, singed nose hairs, as well as singed eyebrows, eyelashes, that sort of thing.
How are you doing?
Ain't too bad.
Got a nice little rifle. Oh man, slapped in the face and knocked out. Fell off a moving train. You're gonna have road rash. You can fracture or break one of those limbs that you're trying to brace yourself with. They say tuck and roll. You're going the same speed as that train. I was gonna get kicked by the horse. Oh no, they're just manhandling fights. Oh, I'll say no surviving that fall unless you land on a bunch of trees that it's a canopy that looks like a net for you. You hit your head there. Maybe it's a good thing in the sense of like become unconscious and not realizing you're falling to your death. Oh! Talk about stabbed in the back. It could get to the heart because the heart is center left. If you're actually close enough to the spine on the left side and goes through past the ribs, you might be able to actually puncture the heart.
You got an annoying kind of face. Here we go.
Oh! Wow. Hitting right into the jugular. If it hits in there and stays in there, it actually is probably not causing you to bleed out. So if that's the case, stabilize it, wrap it, bandage it in the position that it's at, get to somebody that can help you, like a hospital, trauma center. I love it.
I love it.
Gotta be careful of glass. It easily will lacerate you, especially if you're trying to clean it up. Don't do that. Use a broom versus your own hands.
Oh my God.
Oh! That's a knife to the suprapubic area. Could impale the bladder if the bladder was full. Could hit the rectum on the other side or part of your sigmoid colon. Oh, he's trying to get up. That's pretty good. Wow. Trying to run away. Obviously, if you're stabbed somewhere in the body, if you're in a situation where you got to get out of there, you got to do what you got to do. But if it happens and nobody else is around, don't just take it out. Leave it, stabilize it, walk slowly, call an ambulance, get to the hospital. How did they run into each other? Oh. Hit his head, and now he's altered. He might have a brain bleed, something called a subarachnoid bleed, a subdural bleed, an epidural bleed. These are all different types of bleeding that can occur in your head from a trauma.
Busy day?
What, they pay you for 40 winks, huh?
Well, keep at it.
You take care now. Nice gun.
Wow. Sometimes people will be injured with multiple gunshot wounds and they're okay. Versus sometimes people will actually get one gunshot wound and they don't make it. All depends where the hit actually takes place and a lot of times caliber of bullet.
I'll happily pull this trigger.
Oh! What the? How much force was on the neck? You can press down the trachea enough to cause somebody to stop breathing. And then the other component is so much force around the blood vessels of your neck. If you hold on for too long with both of those, you're gonna cause asphyxiation and decrease oxygen to the brain.
That's what you want?
You're dead.
Oh! I was all worried that he was going to get impaled. We see people who have actually come in with pieces of fence still impaled into their body and we have to take it out. Most of the time it's soft tissue injuries if they're still alive, just through the tissue, the muscle, the fat, versus through vital organs and then causes somebody to die. Whoa! Holy cow. 3rd-degree burn, eventually the pain will stop because you're burned through all the nerve endings. Hopefully you get the burn out.
You're done.
What?
I'll kill you again in hell, my friend.
He missed him with a gunshot and he got him with a knife. I mean, cool, it's a game, obviously. We got these rusty knives that can cause bacterial infections and then you're gonna potentially die from an infection that you don't have treatment for.
Good God. Easy there.
Whoa! He's hit left upper chest near the neck. Your aorta comes up and then the arch kind of comes down and around. If you hit there, blood's gonna be coming out a lot. Kind of really accurate and interesting. It's actually more realistic of what happens in real life. Obviously, you're gonna try to stop the bleeding. Hopefully you have a surgeon on hand that can basically get in there and fix it for you. No, don't do that. Oh, No, he does it again on the other side. Oh my gosh. I've always said it a million times. Do not pull an impaled object out because you can cause more damage. Now, he's in the middle of the wilderness and he may have to do that. You want to actually get to help to get the bleeding to stop. That way you can salvage the rest of the limb. Oh, he's on fire. He's patting it out, which is fantastic. If the blister is not opened, it's protecting, it's sterile. It's when those wounds open up, you want to use an ointment.
You want to borrow my ointment?
Keep the wound clean. People think to dry it out, you actually want to keep it moisturized. Oh, nice. Perfect. He was able to use a type of dressing. It could be a dressing that's impregnated with like an antimicrobial type substance, or it could just be to protect the area so you don't get schmutz and dirt into the area. Oh, no! The way that it's hanging there, it's definitely double boned. That means the radius as well as the ulna are fractured. He resets it, which we actually do in the emergency department. But typically after you reset it, you need to put a splint on it because it's still floppy. It's not attached anymore. Oh, nice. The way that it's sounding and crunching, it's probably broken. Once the joint is out of place, all the muscles spasm and keep it held in that bad position. So if you can actually get the muscles to relax, you can pop it in pretty easily. Oh, ow, no. How do you get a nail in between your tissue here? Depending on where it is, it's probably fine. It's probably going in between your metacarpals and it's just a soft tissue injury. But you always worry about tetanus, so you have to make sure your tetanus shot is up to date. Oh, rebar to the abdomen. Again,
Pull out game weak.
if you hit the intestine, you pull that out, now you have flying out in the abdomen, you become septic. And if it goes untreated for too long, you're gonna die. Oh! Snake bite, you have to get Crofab if you get bit by one of these snakes to counteract its effects. There are multiple different venomous snakes out there. Just know which ones in the area that you live to be aware of. Oh, nice. Just using like good bandage. You always have to worry putting on a bandage. You want to make sure it's not too tight because you can actually decrease blood supply. Your hand turns purple, white, blue, and tingly and numb. If that occurs, take that off and rewrap it. What is that? Oh my gosh. There's only a few instances where you actually go after the bullet and take it out. Most of the time you just leave it in. The risk of causing damage to the tissue is greater than in that moment of potential poisoning. Oh man, maybe the bullet's causing pain. If it is that superficial, you can take the bullet out. You're using dirty things to get it out, so you have to worry about wound infection. Bullet wounds themselves, because they're so high pressure and so much heat, most likely not going to cause an infection. Falling. Oh my gosh. Here he's got a floppy wrist, potentially fractured the distal ulna, distal radius. If it goes into the joint, you always run the risk of having chronic arthritis, so really need to be careful. Oh my gosh, you have to worry about the different microbes that are actually in the ocean water. At least get it cleaned out and then watch it. And then if you start seeing erythema or redness to the wound starting to creep up, get to the hospital. You probably need certain different types of antibiotics. Oh! Wow! The hand itself is so vascularized. There's a lot of special nerves in there. It can cause a lot of damage. You just have to be really careful because once you injure these type of distal nerves, you're probably not going to get them back because they're so small and you can't really fix them. They're just tiny little strings. Oh, he is just so shot up that he's just taking out all the bullets that he can get. Nice. Bullets don't just hit the tissue and typically stop. Usually they go through the tissue and cause damage on the routes that they take. A lot of times we see bullets that just go through and through. Nice. When in doubt, throw a good wound dressing on there. Sometimes we use a dressing like this that might be impregnated with an antibiotic ointment, so to speak. Oh no! Will that hurt like a son of a? Yes. Can you actually do that? Yeah, you can. In the hospital, we do something similar. We have a Bowie knife. It heats up so it can actually cauterize small blood vessels. All right. Oh, you know what gets me with these is the sound. It doesn't make that kind of noise. Is he using his own teeth to pull that out? Oh my gosh. Every time he fixes himself, he's like, you don't want to move it. It's going to hurt like hell. Uh-oh. Driving a truck or an SUV. Oh, he's popping pills. It could be related to ibuprofen, could be antibiotics, could be pain medications. Oh yes, the famous good duct tape. You can use duct tape for anything. It covers wounds, you can take out splinters with it. You can even treat plantar warts because it takes a little bit of the skin off every time. So you put it on, take it off, put it on, take it off. What happened? Oh man, oh. That is gnarly. Are you gonna bleed out and die from your hand? Probably not. In this situation, probably just fine to pull it out, but you definitely need to do a pressure dressing to that area. The cigar is probably just hanging out in his mouth because he's walking around holding his pistol with 2 hands. You're giving up your position by having smoke around you, but at least you're able to use it to then cauterize your wound. Oh, nice. In a lot of these depictions, you don't have the amount of swelling that you would have, even instantaneously. It's good that he's actually relocating them quickly because the more swelling that you actually end up having, it's harder to get it back in the joint. Oh, the fingers. I have seen so many x-rays where the fingers like almost like 90 degrees. Very easy to put back in, almost like you want to like pop your own joint. Does it hurt? Yes, of course, but it feels so much better once it's back in. That's pretty cool. So I wonder if he's using the duct tape as a way to defend himself against the wolves there. And maybe this way it protects you a little bit against the bite. Obviously, teeth can penetrate through that, but maybe it gives yourself a little bit more time to defend yourself. Walking through a swampy area back in Vietnam and stuff like that, they always ran the risk of having something called trench foot, where their socks and their boots were always wet. You always increase the risk of gangrene, wound infections, things that won't heal because you have tissue breakdown. Oh man, rusty metal. I bet this guy's had so many vaccinations. Probably gets a tetanus shot every year. Oh, straight through. If you hit into the bone, one, it's gonna be harder to get out. And then you really worry about something called osteomyelitis, which is an infection of the bone. If somebody gets that, typically it's 6 to 8 weeks of antibiotics. Think about that. Nice. Forearm injury, we're wrapping it with duct tape. Duct tape is used for like everything under the sun. For a potential wound dressing in an emergency, it is good. Getting it off is gonna hurt a lot, but you're in a situation where you need immediate closure of a wound, get something to stop bleeding or protection. I think that's fine. The glue on the duct tape is so good and so strong that they actually tell people they can heal plantar warts by putting duct tape on and pulling it off. Classic, popping some pills. White and blue capsules. Patients will come into the emergency department all the time and say, oh, I take the blue pill, or I take the red pill, or I take the one that looks like this. They're all different colors, shapes, and sizes, even for the same pill. They have really good apps that we have on our phones where you can look up the color, the shape, and then sometimes on these capsules or tablets, they'll actually have a number or a letter, and you can input it and you can actually figure out what the pill is. Oh, nice. The noise. Actually, sometimes it makes a pop noise. Sometimes the only noise is the person screaming. No, I'm just kidding. Typically, what we'll end up doing is not just grab and pull without any anesthesia. Sometimes a patient wants a pill to help with the pain, but a pill is going to take like a half hour, 45 minutes to an hour to get in your system. Oh, but it doesn't make that kind of noise. Typically, a shoulder dislocation that we put back in might make a clunk noise, and same with the femur putting back in place if you have a hip dislocation. Oh, we got a limp wrist. When somebody comes in with a wrist this way, I'm not thinking that it is fractured or broken or dislocated. I'm thinking like the nerve doesn't work anymore, that there's another type of injury. Kids will come into the ER with their arms like this, and it's called a nursemaid's elbow. What the treatment ends up being is just to turn it over and flex it back up. Let's see. Oh man, snap, crackle, pop. We're probably going to get an x-ray of it in the emergency department because we have time, and we want to make sure that there's no fracture, and we want to make sure that we don't cause a fracture. If there's a fragmented piece of bone in the joint space and you try to do conscious sedation and you try to then put the dislocation back together, you have a bone in the way and nothing's going to work. So then you just sedated the individual for no reason.
No reason!
Oh, just let me just take out a cigar. The wound is open, bleeding, and you can't get the bleeding to stop. You're in an area where you don't have bandages. Maybe you can burn this. In the emergency department, the only time we do use heat or cauterization is typically if we're doing something called a trephination. Somebody has blood underneath a fingernail that causes a lot of pain and pressure. So you can actually just pop a small hole through the fingernail. You burn a little hole straight through it and the blood releases. The pressure feels much better. Why would you have alcohol in the game? Maybe for pain. When that alcohol wears off, you got the headache from a withdrawal, you might feel nauseous and vomit. If you do enjoy the occasional drink, but you want to try to prevent the bad day the next day, check out Poor Decisions by Life Happens. Oh. Whoa. Small impaled object. You guys always know I say please don't pull it out. But in this circumstance, you probably need to pull it out because you don't have anywhere to go to get medical care. When you pull something out that's been impaled, you have an increased risk of a major bleeding episode. But these are forearms. The likelihood of major bleeding that can't be controlled is low. Worst case scenario, you need to use a tourniquet to get the bleeding to stop. Oh. These impaled objects, they look pretty jagged. Are they metal versus like wood? Could they leave splinters in there? Maybe. Splinters eventually make themselves pushed out of the body. They eventually get out. But again, increased risk of infection. And now you have open wounds. So make sure you put bandages on this. Most of the time, I tell patients to put antibiotic ointment on top of these. The ointment itself will help heal the wound. And then obviously the antibiotic component to help prevent infection. Oh, man. Ouch. Palmar surface probably between the bones because it wouldn't come out so easy when a nail, kind of a nail, it's like a sharp metal object, is punctured through bone. It actually sticks pretty good. It takes a lot of effort to get it out of there versus the soft tissue. Now you have nerves that run down in that area. You also have a lot of muscles. It just causes a lot of pain. Oh, right through the palm. Puncture wounds increase the risk of getting infected. Making sure your tetanus shot is up to date is important. And then good wound care. If somebody has a bad puncture wound, we'll actually clean it out really well. But then you can't really close the wounds up because you want it to drain out, because if you seal that wound because it's a puncture wound, you have an increased risk of it becoming infected. And especially the hands where it's so far from the core, if you get infected, it takes a lot longer for it to heal versus if something is more towards the center area of your body. Oh my gosh. My favorite. Come on. Come on. We're using pliers to pull out bullets. Get the bullet out, you save the life. No. The bullet, majority of the time, isn't superficial where you can just grab it out. Obviously, if it is just simply superficial, yes. But it's typically buried within the tissue, deep in the body. And most of the time, if it's not easily accessible, it is actually left in the body. People always ask is, what about lead poisoning? That's why I tell people to avoid getting shot. And then second, you potentially can go see a plastic surgeon or a specialist to look in that area and see if it would be advisable to have it removed. Oh, looks like vomit. Oh my gosh. So everybody's vomit is pretty much a few shades of a very similar color. A brown, a clear, a yellow, a green. If you're seeing black, if you're seeing like bright red, that's very worrisome that you're having bleeding or digested blood. Oh, massive syringe, futuristic or barbaric. I can't make the difference. You got tubing, tubes, and this massive needle that is pretty blunt tipped, if I have to say. It should never happen that way. Yes, we do IM injections, but we're using smaller needles and we're more gentle about it. You're direct into the bigger muscles. No. People get bitten by these type of reptiles and they lose limbs. They're very jagged. If you get the limb back, really hard to put back together. If you were to lose a limb, remember, hold pressure. If you can't control the bleeding, use a tourniquet. Whoa, shark infested water. The black-tip sharks actually swam with black-tip sharks. They're not that big, but they're like, holy crap, I am surrounded by sharks. Oh my gosh, it's got his thigh, leg. Look at this. Oh my gosh. Hard to tell. Most likely the shark has got a hold of the upper thigh. How could you succumb to the injury if you haven't taken the leg? If you hit the femoral artery, which is right in the inguinal ligament, right at the crease of your groin, that's where a very superficial area where your femoral artery would be. And if you get that lacerated open, it's a pretty big vessel. You could bleed out pretty fast, not super fast, but pretty fast. Oh my gosh, some big piece of wood pulling right out of the forearm. Are there major blood vessels that you're going to injure yourself with if you pull them out? Yeah, there are some actually. Now you can fix it. You can put a tourniquet around it. You can push pressure on it. You would just have to know that risk of what's happened. Oh man, so modern day arrows, you try to pull it out, it actually gets stuck. Sometimes the better thing to do is to push it all the way through or cut that end off and then pull the rest out the other direction. Now this game is like forever in the past.
Quit living in the past.
It's probably just more of like a blunt tip, but they still have the wings on it, so to speak. So you can see on the second arrow that he pulls out the one end, snaps it off, and then pulls the other end out, exactly as I just described. Even in this situation, you can still wrap it to prevent the bleeding. Oh my gosh, just the sound. It gets stuck in the bone. It's actually stuck in the bone.
It's in the bone. It's in the bone.
Hard to get it out. It may need to be just snapped off and leave it as is, especially in a situation where this individual is running around in the wilderness. Oh, he's on fire. Stop, drop, and roll. There you go. We finally... Stop, drop, and roll. It's the first thing that comes to my mind. Patting it out, you can do that, but you're potentially going to burn the palm of your hand. And then the other thing obvious would be to take off whatever is burning, such as the clothing. Oh, we get people who dislocate fingers very often. Normally it occurs at the PIP joint, which is the proximal interphalangeal joint. To put it back in, you actually pull a little bit so you can disarticulate where it's stuck and then pop it right back over. Oh, I'm like, what is he swinging at? But it is a bee. I hope he doesn't have an allergy to bees. If you have an allergic reaction to the bee, we're gonna give you epinephrine. Obviously in this setting, that ain't happening, so don't piss off the bee. Bees are really good. They help with pollination. They help with the environment. Try not to kill bees if you don't have to. Oh my gosh. This is like a major onslaught of arrows to the forearms. Prehistoric time, there have some probably medicinal things out there. Would I pull these out in these situations? Yes. What else are you going to do? You're in the woods. You're potentially going to die. You also increase the risk of having infection and dying from that, but you have to weigh the risks and the benefits. Oh, sweet. Wait a minute. Oh. I don't know how that guy got burned.
How'd it get burned? How'd it get burned?
If you have that many flames around you, the flames are taking the oxygen away from you. So you're going to have difficulty breathing. You're freaking out in pain. You're going to be breathing heavily, which then you're going to be breathing in the flames, which is going to increase the amount of inflammation. And then you're potentially going to cut off your own airway as well. Oh man, he threw a ton of bees at him. We'll have people that come in who aren't allergic to bee stings, but because of the amount of bees that actually got them,
I'm covered in bees.
it causes just a massive inflammatory reaction. We've had people where the pain is so bad that we'll literally intubate them, sedate them, just knock them out so they don't have to suffer through this pain while their body is trying to defend itself, so to speak. Oh yeah, sweet. So I love it. I love it. Okay, finally I'm seeing this. He's actually putting things on his wounds to make sure that they don't get infected. Super cool. Plants are amazing. There's a lot of plants out there that actually do have the ability to help decrease inflammation, fight off infections. Some of the medicines that we have today are derivatives off of plants that were used way back when.
We are the flower children.
Oh, it's like getting soothed by his wound healing. Even the military does this if they don't have wound dressings, is to pack the wound filled with dirt. Obviously, it increases your risk of infection, but it's going to stop you from bleeding out and dying. Oh, we got a boar. Get the boar. Is that a boar? No, it's a lion.
Lions and tigers and bears.
Oh, my.
It's getting slashed up. It looks like probably a female lion.
I'm a lion!
Don't mess with big cats. The bite wounds are going to potentially cause infection, and same with the scratches from the nails. There are 2 bacteria that we worry about relating to cats, Bartonella henslii and then Pastorella. We have specific antibiotics against, but not them. They're using all these arrows. The question is, were they poisoning the tips of their arrows with a dart frog? It messes with your nervous system and it's very, very toxic to humans. Do they just put their arrows in your fecal material? That way you do get infection when it actually hits. Is that something that they knew of back then? I don't think he needs to rip it out in that setting unless it paralyzes the arm or incapacitates the arm, then he can't use it. So in this case, don't pull it out. Ooh. On the top side, this would be your dorsal aspect. Most of your blood vessels are actually on the underside. They're protected. So where he had the wounds, it was just stuck in the tissue. You just get abnormal bleeding. You're protected by the bones with the arteries at your wrists. Oh my gosh. You should be wrapping them up. Obviously, you're wearing clothes, so you should potentially even just take a piece of your garment and wrap it around it. To stop bleeding wounds, you need to put pressure. A lot of us just put bandages on them and don't put pressure on them. They're going to continue to ooze or bleed through. Wow, super cool. Really cool that they're actually putting stuff in the wound. Obviously, we don't put things in the wound very often, especially if it's an open wound and it's healing because you can't close it right away for whatever reason. Even using the stick in the mouth to bite down for pain, people still do this. Grit your teeth, so to speak. Even when I work out, sometimes I wear a mouth guard because I'm gritting down to lift something really heavy. Super painful. It's like pushing really hard in there. A lot of times when people come in for wounds, we'll numb it up with lidocaine first. And the pain from getting injection is actually the medicine itself. The acidity of the medicine will actually cause it to burn and feel uncomfortable. The needle itself is so small and the wound is already cut. You have already injured the nerves that typically the needle doesn't hurt. It's actually the medication that actually hurts. Tough. Cool, and then you're gonna put a leaf to cover it up, right? Nice. Then yes, you're gonna cover the wound. You may put antibiotic ointment in there. There are different leaves out there that do have some anti-inflammatory and medicinal uses. You wanna make sure that you know what plant or leaf that you're actually putting on your wound, because there are some good ones and there are some that are toxic and actually cause more harm and cause infection. So you really need to know what you're using out there. Oh, I like the injection. What is he injecting to himself? Most likely either pain medication, probably like morphine. It's an auto injector, pushing the button and it injects in. Something similar that we have, epinephrine. If somebody has the EpiPen, it's an auto injector. Some people who are diabetic, sometimes have almost like an auto injector like this for insulin, where they can put the dose on the outside, calculate it, and then they can inject it in. Oh man, that was a huge shot. Definitely got shot injured because I see on the upper left that there's a change of color to the left arm. So I wonder if he got shot and needs to be healed. What can you give yourself that could actually heal that fast? Nothing really. Your choices are basically pain medication, adrenaline, maybe a topical or an injectable anesthetic like lidocaine just to help with the discomfort. Could be ibuprofen, could be Tylenol. Walking around. Typically, if you're going to do an IM injection, you want to go into a big area, big muscle. That's why at the hospital, we typically use the shoulder or the deltoid, or we'll use your buttocks or the big glute.
Maybe just one glute?
It's also an area where there's a lesser chance that you're going to hit a vessel, because the whole idea is you're going to inject these intramuscularly, not intravenously, and you don't want to hit a blood vessel because then the doses are different. Oh, we got a meg bag. Trauma shears, really cool. One of the blades basically has a little lip on it to help get underneath stuff. Oh, I don't know what he just took out there. It looks almost like a type of forceps, like a ring forceps or Kelly clamps, so you can actually grab something. They are ring forceps, actually. On the end, they're circular, so you can grab things easily. That's what that's for. You can also clamp things down.
The clamps!
Oh, we got a screen with some blood. Shot to the chest, possibly. Here we have a syringe, because you can see the plunger on the top. Trying maybe to show that we're doing it intravenously versus IM, but through the clothes. Typically, we tell people to do the auto injectors. If you're giving IM, clean off the surface. Whatever's on your skin is going to get inoculated into your tissue, which increases the risk of infection. Cool weapons. Oh, we got some bandages. Okay, so sometimes we call these like curlics. Typically, if you're gonna wrap a wound, put some more heavy gauze in the area, then wrap it so it stays in place, compress the area. Sometimes what you can do is actually split it in half at the end, and that way you can actually tie it into a knot around the area. That way, if you don't have tape, you can do it that way. Oh, we got a bottle of pills. Just carrying a bottle of pills in my pants.
A bottle of pills.
Purple label. Can't really make out what the lettering says, but really cool, very interesting. You're trying to open the bottle and you can't because you gotta like push it down, push pressure, and then turn it. One big pill like that. I know people out there probably have had prescriptions for 600 or 800 milligrams of ibuprofen. They look like that. Antibiotics look like that as well. Could be pretty much anything. If anybody knows, let me know in the comments. Speaking of pills in the pocket, I don't know if you guys know or not, I launched a supplement company called Life Happens. These are not just your everyday vitamins that you've seen on the shelves. These are as needed when life gets you, researched and studied ingredients. So definitely check it out. Oh, we got another med kit. I actually have a med kit that I travel with, even though it's just civilian travel. I want to make sure that I have like sutures and a needle driver just in case. I have some numbing medicine. I got a lot of bandages. Oh, what is this? We got some like salve. We got some balm.
Who told you to put the bomb on?
Is that used for the lips? Is that used for the skin? Really good for hydration. Even if you're getting like windburn, it's good. You don't want to have like cracked bleeding lips. You don't want to have like cracked uncomfortable skin. So you definitely would use something like that. Or is it used to like clean your weapon or moisturize your gloves? You know, that's another thing that people do with this stuff. Oh, there we go. Is this like a meal? There we go, an MRE, right? MRE stands for Meals Ready to Eat.
Mr. E.
I think you do have to do some heating maybe to it, put it out in the sun. Tell me if you've ever eaten one of these. Really cool that it's in the game. In the emergency department, people are always asking about food. I mean, it's not the best. We got graham crackers, we got turkey sandwiches. Turkey sandwiches are very specific. It's actually been studied. We specifically have them for people who might be hypoglycemic.
I'm hypoglycemic.
It actually helps with the blood sugar the best, as well as juice. Really cool, that white piece right there is a type of staple gun. Sometimes they're that big. Those are so much easier to use. Then we have really little ones. In the emergency department, we typically will use on the scalp and maybe some big massive areas. But most of the time, if it's anywhere else, we'll actually suture it with just simple interrupted stitches. So cut off the clothes. Is that supposed to use the tool to pull out the bullet? That's hilarious. We don't go digging for bullets. We do not take them out. If it's just superficial where it's so easy to like grab it and like pop it out like a pimple, no problem. But other than that, if it's deep buried into the tissue, it's left there. Causes a lot more devastation to the tissue as you try to get it out. Oh, cool. I like this med kit. What's this? Oh, we got some bandages wrapping around the arm. Very cool. That almost looked like 1-inch tape going around. Could be wrapping something. Different types of bandages that actually are impregnated. Yes, I said that word, impregnated, with different ointments and antimicrobial things to prevent infections. Oh. We got a needle popping off. I love the technique of like flipping it off. At the hospital, we don't do that because somebody's got to pick it up and I'm not going to make somebody else pick up my trash. We deal with a lot of people, unfortunately, that use IV drugs illegally and they inject and they miss the vein and they inject into the subcutaneous tissue, into the muscle, and then cause bad abscesses and infections. Oh, this is a sweet bandage. That was actually a huge bandage that probably has some sort of special medicinal properties in it. If you're bleeding, cover it up. A lot of pressure. What we're not seeing in this video game is the fact that you're not putting pressure directly onto the wound. You're just wrapping it and covering up quick injections. I mean, it's fine. It's for the speed of the game. It would be cool to be shown, hey, you push pressure on it. Looking at the image, we got arm problems and abdomen problems. All right, wrap the arm. Oh, that looks like a type of tourniquet. Probably not tight enough. I carry a tourniquet in my car as well as in the house, just in case. The classic one, it's the cat, and it's basically a tourniquet that velcros onto itself, and then it actually has the ability to twist, so then you can actually make it super tight, and then it will lock in place. And then you actually want to write on it, there's a place for it, of when you actually put it on. We just like to know how long a tourniquet has been on there. Whoa! What the heck? Injury to the back of the head via a sword. You know, we don't see those very often come into the emergency department, but we do see a lot of knife injuries, hatchet, hammers. Very rarely do we see the blades get stuck. A lot of times we'll end up seeing them bounce off. Blunt objects are going to cause more of an exploded tissue.
Explodes!
Which will cause a laceration and the concern for a fracture of the skull. Whoa! Whoa! Whoa, whoa, whoa. Impaled sword, what appears to be subxiphoid, or what we call the epigastric area. Looks like into the abdomen area. What's over there? Stomach, pancreas, transverse colon, and you worry about the spinal cord in the back, as well as the inferior vena cava, potentially. More likely it's already diverted into the liver at this point, as well as the abdominal aorta. Oy. Oh. Oh, local electrocution can cause nerve injuries, nerve impairment. Greater, like stronger, more intense energy could then lead to cardiac arrhythmias. Typically, we see VFib, VTAC. You can go into asystole. If you're in VFib or VTAC, we're going to use electrical energy if you don't have a pulse. If you do have a pulse, depending on stability or not, sometimes we do still need to do emergent synchronized cardioversion versus are you going to use some chemicals, aka medications. Oi! Oh! Oh, what is that? It's like a chainsaw? It sounds like a chainsaw, and it says cut-o-matic. We're getting cuts on either side of the neck. If it's deep enough, you worry about your jugular vein, your carotid arteries. The jugular vein is the huge vein. It looks almost like the size of a quarter in diameter on an ultrasound machine. The carotid artery looks like the size of a dime. Oh, a crowbar. Crowbar and using the sharper end. I don't know if anybody has actually held a crowbar before. They're pretty heavy and solid metal. Fractures are your number one thing that you see. Besides having the tissue kind of break open, if it's blunt enough, it can cause it to lacerate open. But you can also see significant amount of bruising, and people can lose a lot of blood with a lot of bruising just depending on where it is in the body. And then this could actually be impaled in an individual as well. We're seeing that her facial enhancement is definitely malfunctioning a little. It's a little glitchy, which is pretty cool to see that they've incorporated that in. This isn't that far-fetched. Nowadays, we actually see people get these little chips implanted into their chest wall, and it helps cardiologists monitor their level of congestive heart failure, their ejection fracture, those sorts of things. Oh, wow. We're seeing a left upper thigh injury. The major vessels actually run into the groin.
My groin!
And then dive deep medially, so inside, and then go behind the femur. On the lateral aspect, you're just getting branches off. Less likely that you're going to bleed out on the lateral aspect. There's big muscles there. They're highly vascularized. Again, still could have a lot of damage. Somebody comes to the emergency department with a chainsaw injury. You're missing a lot of tissue. It's going to take a lot to repair it. Now, if it amputates the whole leg off, that's a different story. Remember, if you have an amputation of an extremity, you want bleeding control. Best way to probably bleeding control at that point is a tourniquet. You guys know how to do one. Awesome. If you don't, Jen and I actually made a video about putting on a tourniquet, so check that out on the channel. You know, it's an important, simple skill that everybody should know how to do. Oh, explosive injury has multiple different levels of how it could actually injure you. Explosive component, compressive force, rupture your eardrums, pop a lung. The other components are the shrapnel, debris that goes flying that can impale somebody, the fire, that type of explosive damage as well, burns, and if you're too close, the amount of force could be so much that it gets you. Oh, I'm assuming that is a chokehold. You have two different ways that somebody could maybe get knocked out. You're compressing down the trachea. The trachea has cartilage, but the rings don't go all the way around. They go maybe 3/4 of the way around, so you can compress down, or you're decreasing blood flow to the brain in and out. A lot of times it's a combination of the two, and you can actually cause severe damage and actually take someone's life.
What?
Whoa. Whoa, whoa. Hey, feel like an ear just got chopped off. What would you do if somebody sliced off somebody else's ear? Well, bring the ear to the hospital with the patient, put compression on the area to get the bleeding to stop, and hopefully you're at a facility that has a plastic surgeon that could potentially replant the ear. Sometimes you can't.
You can't.
But they do have the ability to have prosthesis to your ears in the future.
Oh, you're right.
Whoa, 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 whoa. I wouldn't stand there, guys pulling out again. Oh, nice. Blocked right in the chest and cause them to succumb to their injury, either right to the heart or right to the lung, causing a hemopneumothorax that's not treatable in this situation. If you came to my hospital or the trauma centers around the US, we would end up doing a thoracostomy tube, putting a tube in the chest, get the air out, get the fluid out, get the lung to reinflate. Hopefully it fixes itself. Oh. Oh, whoa, we got a new move. Taking the neck in such a extreme range of motion is what causes the issues. You're ripping vertebral arteries, which run in the sides of the spine in the neck. You're ripping the bones and the connective tissue. That's the noise that you're hearing. And then you're destroying the spinal cord. High up has to do with autonomic nervous system, function of the heart and the lungs relating to just breathing. But whoa, that was crazy. What just happened? What just happened? What just happened? We're seeing anatomy a little bit. You're actually seeing like white, stringy looking things. This is most likely either depictions of nerves or tendons, most likely nerves, really interesting. And in the middle, you're seeing, could be the spinal cord, but it's hard to get everything that you really want to see in there because you have the spinal cord in the back surrounded by the bone, but you're still gonna have your airway and your esophagus in front of it, but they don't typically show it. They just show that as meaty tissue. We got a knife. Oh, I just see the head gone. Could be a puncture wound, high up, suboccipital, so below the occipital lobe in the back, can pierce right into the spinal cord, high up, autonomic nervous system. Oh, that's a high jump. Wow. The jump onto somebody, breaking your fall, so to speak, but again, you can have significant injury as well. Facial trauma into hard surface can cause fractures, could cause intracranial bleeding, could cause whiplash injury relating to cervical spine trauma. We do see this often enough in the hospital where somebody has a mechanical fall or a syncopal episode where they pass out. They fall and they smack their head. Usually it's skin bust opening, bleeding, plus or minus skull fracture, plus or minus intracranial bleeding. Oh, oh. That one was different. When we see somebody who has a massive amount of skin gone, it actually makes for repair really hard. Like where you're gonna harvest the skin from, you can't just undermine a little bit the tissue around it to pull it in. It's not enough tissue. So a lot of times that instance, you'll actually need a skin graft, and that's when you need a plastic surgeon to be able to help figure that out. Intense extra weapons. Oh, whoa! Impaled injury to the lower abdomen, almost into the pelvis. See, that's almost coming out where the sacrum is or your lumbar spine is. You can actually miss major vessels because the aorta comes down and then branches off into like a wishbone scenario to go down each leg. So it actually might go through that. But you got the bladder, you got your rectum, you got intestines and omentum. So a lot of other structures there that won't necessarily immediately kill you. Fire, things I worry about, burning skin, flesh falling off, pain, and then airway issues because the fire can take away the oxygen around you, as well as inhaling the fumes and the smoke. When somebody comes to the ER, we'll examine to see if there's singed hairs around the nose, soot in the nose or the mouth, to see if there's anything in the posterior pharynx. We get concerned that there could be airway compromise in those situations. Ooh. All of a sudden, we don't need to worry about that. We have an injury to the submental area, so underneath your jaw, up into the face. It could actually just be a flesh wound, versus if it goes far enough, you can go into the brain tissue, into the eye socket, and then you can also go backwards deeper into the airway. Watching all of these chaotic encounters is enough to make anybody stressed out. If you're feeling like you need a reset after all of this, definitely check out Chillax to help you stay calm. No implants required. Grab yours at lifehappens.com or on Amazon and get your chill back before the next glitch. This whole scene is just filled with a lot of skulls getting separated and massive traumas. Could this occur from a blade like this? Probably not. You need a very sharp blade or a massive amount of force to make these things happen. These type of injuries do not come to the emergency department because they're not compatible with life, so they would not be brought through the emergency system. They would be pronounced on scene. Hand-to-hand combat. Whoa, hand-to-hand combat, but you're getting shot. Hopefully you're wearing protective gear, but not everything is 100% bulletproof. It does have weakened spots and it can get destroyed. Injury to the face, you can stun somebody, you can get dizzy, you can get lightheaded, you could actually pass out. Enough force to somebody's head, or even blunt, can actually shift your brain in and out of the skull, causing a counter coup injury where you can have bruising to the brain, or you can rip the bridging veins and cause a subdural hemorrhage. He's wearing one of those N99s, or the masks that we almost used back during the pandemic. We use N95s, but in different industries, they actually use higher numbers, and has to do with like particle size. It's getting impaled in the abdomen, and actually quite interesting, trying to grab it with his hands. It's not instinct to do that per se, because you're gonna cut your hands and it hurts, but it actually might be of benefit. Oh, wow, that is that blade reminds me of Rambo's.
They drew first blood, not me.
Stab to the left side of the chest, could go into the lung or right into the heart, but you're breaking through the ribs as well, which is quite painful. You're going to cover the wound, put packing on it. Person's going to have difficulty breathing, most likely if it's related to the lung. Could be a hemothorax or a pneumothorax, both treated very similar with a thoracostomy tube. Oh, get out of the way! Oh man, that is awful. We call this a pedestrian versus car. This person is walking across, gets hit on the left leg. Things you think about: femur fracture, pelvic fracture. Then the way that you fall, you think about a traumatic brain injury, head injury, skull fracture, intracranial bleeding. Then you also think, okay, all the lacerations, abrasions, the road rash. What? That looks like somebody's getting electrocuted. You always worry about something called DC versus AC current. That probably is what we call AC current, which is alternating current, which causes flexion of the body. You worry about rhabdomyolysis, breakdown of the muscles, which then can actually clog up your kidneys, which can cause kidney damage. Treatment is a ton of fluids to try to clear all that out, and you got to use IV fluids in that circumstance because you may not be able to keep up with the amount of oral fluids that you need. What? Come on. Oh my God. What? All their limbs just separated from their body, even the head. Typically, when people fall from a great height and land on their feet, ouch, you cause compressive force type injuries. So you can fracture all the way up because of the energy going up. So you think about calcaneal fractures, you think about different types of joint fractures all the way up. You can have blowout fractures in the sense of the tibia fracturing, the fibula fracturing. Oh my gosh. Obviously, these weapons are a little bit different. Taking a gunshot wound to the chest, it depends on closeness, the caliber, the type of weapon you're using. We see anything from subcutaneous tissue injuries to, death. You hit the heart in the right place, you can rupture one of the ventricles or the atrium of the heart and you bleed out within your own chest, or you can puncture a lung and it compresses down so much that it causes decreased cardiac output. Whoa. Oh, what the? Almost reminds me of an onion like slicer, the little device that you can just like chop up onions really fast into quarters. Obviously, totally dismembered. These things don't come to the emergency department. People will have severe injuries on scene to where the injury is not sustainable with life, or they're dead on scene. And in the United States, a medical examiner will actually go and take the case versus going to the hospital. Oh my gosh. We'll see nail gun injuries where go into somebody's soft tissue, puncture the lung, or go into the skull. Obviously, we take them out of the hospital, get imaging. Other components of these things, people fall down and they puncture themselves with different objects. The mechanism of injuries are all different, but at the end of the day, it's what underlying structures could be injured, how do you look at it, and how do you fix it. It looks like the thorax, aka the chest. Blood splatter onto the wall looks appropriate. I'm not a blood splatter expert. I think Dexter is from that TV series, which is really good. You can have a single gunshot wound that somebody could succumb to their injuries, or it could be fine. It could literally ricochet off the sternum or the manubrium and deflect off and go into your shoulder or into your arm. It just depends. I'm assuming X marks the spot. So we're seeing blood splatter, but nothing flying off. These injuries, extremities, you definitely have to worry about blood loss and major blood vessel injuries. So if you see an arterial injury, you may actually end up doing a CT angiogram to make sure that the arteries are intact. If a vein isn't intact, it's not as life-threatening in that moment as an artery injury would be. Whoa, too far. Oh. Whoa. So you get the knee slide. Totally cool if it's super slick, like slip and slide or like ice. But if it's not, you're going to rip through those pants. You're going to cause horrible abrasions to those lower extremities, and it might be deep enough that you actually require a skin graft. So be aware of that. Oh, what is that? How is that even a weapon? Laceration, you see those type of injuries in, like, say, Mortal Kombat, where they slice through and you see the anatomy, which is quite cool, actually, just the anatomy. But this is probably more blunt trauma, and blunt trauma to the chest. You can actually stun the heart itself. You can go into cardiac arrhythmia just from trauma itself versus causing bruising. And if there's bruising, the tissue is not going to be as well functioning as it should be. So that can cause massive issues as well. What is that? Explosion injuries, we don't see too many of these, obviously. You do worry about, obviously, the initial impact. If you're that close, can it destroy tissue, lose limbs, that sort of thing? Obviously, yes. If you're close enough to it, the compressive forces can pop your eardrums. It can also cause a pneumothorax. Any hollow organ could cause issues. And then any type of burn injuries and lacerations need to be addressed. Shot to the leg. Oh, shot to the pelvis. We actually have structures within the pelvis. Everybody has a bladder in there. Males have a prostate, females have a uterus and ovaries. So different organs within that area, and they're protected by the pelvic girdle, all those bones. But you start shooting in there, there's a lot of major blood vessels that could actually rupture. So you have to be quite careful about that. Oh. What? The head just explodes off.
He's dead.
Oh my. What kind of... That seems like Mission Impossible gone wrong. Belly flopped right to concrete. So compressive force to the area. Obviously, we see blood. Just depends on how high the individual falls from. Skull fractures. You can have brain matter coming out. You can actually go into cardiac arrest. You can have rib fractures, internal bleeding. What happens when they actually come to us? If they're still actually alive, we go back to the basics. A, B, C, D, E. What is this thing? Looks like a mushroom. Whoa, power up. Whoa, what? So I'm thinking Super Mario Brothers, you get a mushroom, you get all like big, get lots of energy. No, this one is like tripping out. There are different types of mushrooms out there. There are good, healthy mushrooms. Mushrooms that, if ingested, actually help with like brain function and energy. But then you have mushrooms like this, where they've changed the vision, and they're psychedelic mushrooms, and they have something called
psilocybin.
It has multiple different properties, and they're actually truly studying this to see if it can help with PTSD and other psychiatric disorders. Oh, what is that? What we see in the emergency department with bugs, insects, we see a lot of people come in with spider bite, spider bite, spider bite, spider bite, spider bite. Spider bite. Did you ever see the spider? No. Could be folliculitis, could be just an infection of the skin area, could be a mosquito bite. But what happens is whatever the bite is, typically it inoculates the normal bacteria that's on our skin that protects us from the environment, getting into our tissue, which then can actually harm us. Other insects that we think about are allergic reaction type stings, such as bees.
Not the bees!
But you also have to worry about wasps and hornets and the murder hornet. All these other things that can cause not just allergic reaction, but severe reactions to where you become hypotensive and you could potentially die. That water is going to be very contaminated. I've been in bad hurricanes where there's lots of flooding and people swam in that water, and because it's mixed in with a lot of environmental things that are not normally in the water, you increase the risk of different types of pathogens. So please be careful with that. Obviously, swimming, you can definitely float. You can do a dead man float, or you can float on your back to raise yourself to the surface. Okay, we are buoyant. When you're in this type of situation, you want to do your best not to panic, because panic increases the use of energy. You want to conserve your energy